You don't feel sick. You don't feel weak. You're not in pain. You wake up. You move through your day. You drink your coffee. You answer messages. Nothing feels urgent. Nothing feels dramatic. But something important may have quietly changed. Not in a way that demands attention. Not in a way that forces you to stop. But deep inside your lower back, behind your abdominal wall, two small organs are filtering your blood every minute, adjusting minerals, balancing fluids, regulating pressure. And when they begin to struggle, they rarely shout. They whisper. The kidneys are not attention-seeking organs. Unlike your heart, they don't pound loudly. Unlike your stomach, they don't cramp immediately when irritated. They compensate. They adapt. They work harder when stressed. And that ability to compensate is exactly why early kidney stress often goes unnoticed. Many people assume kidney problems always come with sharp pain or obvious urinary changes. That assumption isn't wrong. It's just incomplete. In metabolic research, we see that kidney function can decline gradually over years without dramatic symptoms. By the time noticeable discomfort appears, significant adaptation has already occurred. So today, we're not looking for fear signals. We're looking for subtle patterns, quiet shifts, the kind your body uses when it's trying to preserve balance. The first sign often appears in your energy. You may feel slightly more fatigued than usual, not exhausted, not unable to function, just less resilient. The kidneys help regulate red blood cell production through a hormone signal that communicates with the bone marrow. When kidney function begins to decline, even mildly, that signaling can soften. Over time, this may reduce oxygen delivery efficiency. The common myth is that fatigue always means poor sleep or stress, and often it does. But in individuals with underlying blood pressure issues, diabetes, or long-term inflammatory stress, persistent unexplained fatigue can reflect subtle kidney strain. Older adults, individuals with metabolic syndrome, and those with long-standing high blood pressure may experience this earlier because their kidneys have been under higher filtration pressure for years. The second sign can show up in your ankles or around your eyes. You might notice mild puffiness, socks leaving deeper marks, slight swelling that improves overnight. The kidneys regulate sodium and fluid balance carefully. When filtration efficiency changes, even slightly, the body may retain more fluid than usual. The myth here is that swelling only happens in advanced disease. In reality, fluid shifts can begin gradually. In controlled human studies, even modest reductions in kidney filtration rate can alter sodium handling. However, swelling can also be influenced by hormones, long travel, or high sodium intake. This is where context matters. A single salty meal can cause temporary puffiness. Chronic mild swelling without obvious cause deserves attention, especially in people with cardiovascular risk factors. The third sign is subtle changes in urination patterns. Not dramatic pain, not visible blood, just changes in frequency, color, or nighttime urination. You may wake once or twice more than usual. Urine may appear foamier than before. The kidneys filter proteins carefully. When that filtering membrane becomes slightly more permeable, small amounts of protein can pass into the urine. Many people assume nighttime urination is purely age-related. Age plays a role. Hormones shift. Bladder capacity changes. But in fasting-adapted individuals or those with stable hydration patterns, increasing nighttime urination without increased fluid intake may reflect changes in kidney concentration ability. Foamy urine occasionally can be normal, especially with rapid flow. Persistent foaminess, however, can reflect protein presence. It's not a diagnosis. It's a signal. The fourth sign is subtle blood pressure elevation. The kidneys are deeply involved in regulating blood pressure through fluid balance and hormonal signaling. When they sense reduced blood flow, they activate pathways designed to retain sodium and increase pressure. This is protective in acute situations. But when chronic, it can create a feedback loop. The myth is that high blood pressure always damages the kidneys first. In reality, it's often bidirectional. Kidney stress can increase blood pressure, and elevated pressure can further strain kidney filtration units. Individuals with high stress levels, poor sleep, or genetic predisposition to hypertension may experience this interaction more strongly. That's why monitoring blood pressure trends over time is more informative than reacting to a single reading. The fifth sign may appear in your skin. Dryness, itchiness, a subtle change in tone. The kidneys help regulate mineral balance, including calcium and phosphorus. When that balance shifts, even mildly, skin health can reflect it. The assumption is that dry skin is purely environmental, and often it is. But persistent itchiness without rash, especially alongside other subtle changes, may suggest internal mineral imbalance. In metabolic research, mineral dysregulation is often one of the earlier systemic reflections of kidney strain, particularly in individuals with long-standing diabetes. The sixth sign is changes in concentration or mental clarity. Not confusion, not cognitive decline, just a sense of fog. The kidneys filter metabolic waste products continuously. When filtration becomes less efficient, small shifts in circulating waste levels can influence cognitive sharpness. Sleep quality, stress hormones, and blood sugar fluctuations also impact mental clarity. But when brain fog appears alongside fluid retention or blood pressure shifts, it forms a pattern worth noticing. Individuals under chronic stress may experience amplified effects because cortisol alters fluid and sodium handling, adding additional strain to already sensitive systems. The seventh sign involves appetite changes or mild nausea. Early kidney stress can alter how the body handles certain metabolic byproducts. This doesn't typically cause severe nausea in early stages, but appetite may subtly decline. Foods may feel less appealing. The myth is that appetite loss must be dramatic to matter. Often, it's gradual. Particularly in older adults, appetite changes are frequently attributed to aging itself. But the kidneys play a quiet role in maintaining internal chemical stability. When that stability shifts, digestive signaling can shift with it. The eighth sign is muscle cramping. The kidneys regulate electrolytes like potassium, sodium, and magnesium. Even slight imbalances can influence muscle contraction patterns. Nighttime cramps, especially in the calves, may reflect hydration shifts, electrolyte imbalance, or circulatory factors. In fasting-adapted individuals, electrolyte handling differs slightly due to changes in insulin levels. Those with reduced insulin sensitivity may retain sodium differently, placing added demand on kidney regulation. It's important not to overinterpret a single cramp. But persistent, unexplained cramping combined with other subtle signs may reflect underlying imbalance. The ninth sign is a general reduction in exercise tolerance. You may notice workouts feel harder. Recovery feels slower. The kidneys influence acid-base balance during exertion. When filtering capacity is reduced, even modestly, the body's ability to clear metabolic acids can shift. In controlled human studies, reduced kidney efficiency correlates with lower endurance capacity over time, not because muscles fail, but because systemic regulation becomes less flexible. Athletes or physically active individuals may notice this earlier than sedentary individuals because they push their metabolic systems more regularly. Now here's the important reframe. None of these signs alone confirm kidney damage. Fatigue can be sleep. Swelling can be sodium. Brain fog can be stress. Cramping can be dehydration. But the body rarely sends just one whisper. It sends patterns. The kidneys are like a water filtration system in a large building. When one filter begins to clog, water still flows. Pressure compensates. Pumps work harder. Most occupants never notice. But over time, the system strains. Early kidney stress is about loss of resilience, not immediate failure. Certain groups experience these signals differently. Individuals with diabetes may notice protein leakage earlier because high blood sugar stresses filtration membranes. People with high blood pressure may experience pressure-driven changes first. Older adults naturally have reduced filtration reserve, so subtle shifts may represent a larger percentage of functional change. Pregnant individuals experience fluid shifts that alter kidney workload. That's a unique physiological state and requires separate medical monitoring. People taking certain medications, especially anti-inflammatory drugs or blood pressure medications, may experience kidney-related shifts because these compounds influence blood flow to filtration units. Those with a history of eating disorders or extreme dietary restriction may alter electrolyte balance in ways that stress kidney regulation. This approach of awareness is not about self-diagnosis. It's about understanding patterns. Early kidney strain is often silent because the body is adaptable. In metabolic research, we see that kidneys can lose a significant portion of filtering capacity before overt symptoms appear. That adaptability is protective, but it also delays recognition. Initial discomfort, if present, may include increased urination during dietary shifts, especially when transitioning to lower carbohydrate intake. Reduced insulin levels cause the kidneys to release sodium and water. This is not kidney damage. It's metabolic adaptation. Electrolytes play a central role here. Sodium, potassium, magnesium, and fluid intake must remain balanced. Rapid changes in diet or hydration can temporarily stress kidney workload. Gradual transitions allow the body to recalibrate without excessive strain. Metabolic flexibility, the ability to shift between fuel sources, reduces systemic inflammation and stabilizes blood sugar, which indirectly reduces kidney burden over time. But adaptation takes weeks, sometimes months. Forcing extreme changes rarely produces stability. Kidney health is deeply tied to blood sugar control, blood pressure stability, sleep quality, stress management, and dietary patterns. Food is not just calories. It is information. Protein intake influences filtration demand. Sodium influences fluid balance. Refined carbohydrates influence insulin and vascular stress. But extremes in any direction can create imbalance. Moderation, consistency, and awareness matter more than restriction.